Hello guys, and welcome to the respiratory system here at Pharmacy Skills. The human gas exchange organ, the lung, is located in the thorax, where its delicate tissues are protected by a bony and muscular thoracic cage. The lung provides the tissues of the human body with a continuous flow of oxygen and clears the blood of gaseous waste like carbon dioxide. Atmospheric air is pumped in and out roughly through a system of pipes called conducting airways, which join the gas exchange region with the outside of the body. The airways can be divided into the upper and lower systems. The transition between the two systems is where the pathway of the respiratory and the digestive cross, just at the top of the larynx. The upper airway system comprises of the nose, the paranasal cavities or sinuses, the pharynx or throat, and partly also the oral cavity, since it may be used for breathing. The lower airway system consists of the larynx, the trachea, and the bronchioles and the alveolar duct. For respiration, the collaboration of other organ systems is clearly essential. The diaphragm, as the main respiratory muscle, and the intercostal muscles of the chest wall play an essential role under the control of the central nervous system, the pumping action of the lungs. The muscles contract the internal space of the thorax, the bony framework of which is formed by the ribs and the thoracic vertebrae. So in this chapter we will explore diseases that can affect the respiratory system. We begin by looking first of all at ways in which drugs can be delivered to the respiratory system, and what are some good principles for maintaining and keeping these devices, the differences between these devices, and how to select devices for drug delivery. And then we'll begin our journey into the actual respiratory diseases, the main ones here being of course asthma and COPD. Asthma having several guidelines as asthma affects a significant number of the population, so there are several guidelines and they differ depending on the patient's age. So this will be something that we'll spend a considerable amount of time learning and memorizing because it's very examinable. Then we'll look at conditions affecting sputum viscosity, such as cystic fibrosis. Then we'll also look at some seasonal allergies, cough and congestion, which are small sections of the chapter itself. So this chapter is not too long. It's not a very long chapter. It's a short chapter. It's an easy chapter, so there's no reason why we shouldn't master it. I'll see you guys on the inside.